Good afternoon. Good afternoon. This is Dr. Moreau for Cause de l'École. As I told you yesterday, today we're going to talk about men's health care. The reason really we're doing that today is because this month is Men's Health Care Awareness Month. So this means as men we need to take better care of our health. So today we're going to talk about three different aspects of men's healthcare. We're going to talk about heart disease, we're going to talk about diabetes, and then we're going to talk about prostate health. So as always, I'm going to do the invite. And as soon as I'm done inviting as many people as possible, so that way they can join the presentation. So I'm inviting as many men as possible. So if you know someone who's of age, tell them to join this presentation because they will benefit from it. I'm inviting as many people as possible so that way they can as many men as possible. All right, once again, good afternoon. This is Dr. Moreau. So today's presentation is about men's healthcare. First, I want to say thank you to my wife, Dr. Michelle Moreau, for putting this presentation together. So basically, she put it together. I'm going to present it for you. Okay? Again, we're going to talk about heart disease, we're going to talk about diabetes, and we're going to talk about prostate health. So we'll talk about what is heart disease. We're going to talk about the factors, right? The risk factors, and then we'll talk about the symptoms. So what is heart disease? So this is a leading cause of death for men, with coronary artery disease being the most common type. Men are also more likely to develop heart disease earlier than women, with some experiencing erectile dysfunction, which they usually call ED, as an early warning sign. So when you understand the risk factors, when you recognize the symptoms, when you adopt preventative measures, this will be crucial for your heart health. So you need to understand the risk factors, you need to recognize the symptoms, and then you need to adopt preventative measures. So what are the risk factors? So first is age. Men risk for heart disease increases significantly after age 45. Hormonal changes. Testosterone levels decline with age, and this decrease is linked to increased cardiovascular risk. Erectile dysfunction, ED, like I said, they call it ED. ED can be an early warning sign of heart disease, as the same vascular issues that affect blood flow to the penis can also affect the heart. Emotional stress. Men are more prone to certain forms of stress and anger, which can raise blood pressure and heart rate, increasing the risk of heart disease. Family history. A family history of heart disease also increases a man's risk. What are some other risk factors? High blood pressure, high cholesterol, smoking, obesity, physical inactivity, and diabetes also contribute to heart disease risk. So what are some of the symptoms? Symptoms of heart disease in men. So remember, we're focusing on men. Chest pain or discomfort. So this can range from mild pressure to severe pain and may radiate to the arm, the neck, the jaw, or the back. It's a mild pressure to severe pain which could radiate to the arm, the neck, the jaw, or the back. Shortness of breath, difficulty breathing, especially during physical activity, can be a sign. Fatigue, unusual tiredness or exertion, dizziness or fainting, feeling lightheaded or losing consciousness, irregular heartbeat, palpitations, or a fluttering sensation in the chest. All of these are symptoms of heart disease in men. How do you prevent heart disease? Can you prevent getting heart disease? So you can have a healthy diet. So what does a healthy diet look like? You need to focus on fruits, vegetables, whole grain, and lean protein. You can also limit saturated and trans fats, cholesterol, and sodium. Regular exercise for at least 30 minutes of moderate to intensify exercise most days of the week. So I would suggest you guys join me on Get Fit Like a Soccer Player every Monday, Wednesday, and Friday so you can have regular exercise. We start from 5:30 to 6:30. Maintain a healthy weight. Losing excess weight can significantly reduce heart disease risk. Quit smoking. Those of you guys who smoke, smoking is a major risk factor for heart disease. Control your blood pressure and cholesterol. How do you do that? You work with your doctor to manage these conditions with medication and lifestyle changes. How do you manage your stress? Find healthy ways to cope with stress, such as exercising, meditation, or spending time in nature. That will help you manage your stress. You need to also get enough sleep, 7 to 9 hours of sleep, of quality sleep per night. So I know many of us cannot have 7 to 9 hours of sleep. So if you can have 5 to 6, that's also fine. So the less amount of sleep you have, so you need to make it up somewhere else. So if you sleep less, then you need to increase your diet, so or your exercise to make up for the lack of sleep. Regular checkups. So you also need to see your doctor for regular checkups or screenings to monitor your heart health. I know men do not like to visit the doctor, but we need to change that. So as we're getting older, we need to have regular checkups. So you need to visit your doctor. All right, so this is basically everything about heart disease. I went over the risk factors, I went over the symptoms, and I went over how you can prevent having heart disease. So let's go to diabetes. What about diabetes? So we're also going to see the risk factors and the symptoms as well. So diabetes in men can manifest with symptoms like frequent urination, increased thirst, and unexplained weight loss. So those three things will when you see those three things happening, that means you may have diabetes, right? Frequent urination, increased thirst, and unexplained weight loss. Similar to women, but men may also experience erectile dysfunction as well, which is ED, and then decreased libido due to nerve and blood vessel damage, right? So you will have decreased libido due to nerve and blood vessel damage. Men are also more likely to develop diabetes at a lower weight than women and may experience unique complications like recurrent genital thrush. So what is recurrent genital thrush? So this is like a rash you can see on your penis. So if you have a rash on your penis, that means you have recurrent genital thrush. So you need to make sure that you go see your pharmacist or your doctor so they can prescribe you medication for that. So what are the risk factors of diabetes? So age. The risk of type 2 diabetes increases with age, especially after 45. Weight. Being overweight or obese is a major risk factor for type 2 diabetes. Family history. Having a family history of diabetes increases the risk. Lack of physical activity. Not getting enough exercise can contribute to diabetes. Again, join me on Getting Fit Like a Soccer Player every Monday, Wednesday, and Friday. I'm here with you from 5:30 to 6:30 to help you exercise. Ethnicity. Certain ethnic groups have a higher risk of developing diabetes. So, what are some of the more symptoms that you need to watch for? I mentioned 3 earlier, but we're going to go over more symptoms to watch for that could indicate that you have diabetes. So diabetes, frequent urination, like I mentioned earlier, especially at night. High blood sugar leads to increased urination as the body tries to flush out excess glucose. So frequent urination, especially at night. Increased thirst and dry mouth. Dehydration. Dehydration from frequent urination can cause thirst and dry mouth. Unexplained weight loss. When the body can't use glucose for energy, it may start burning fat and muscle tissues, leading to weight loss. So when the body can't use glucose for energy, it may start burning fat and muscle tissues, leading to weight loss. Some more symptoms that you can look for. Increased hunger. The body's cells are not getting the energy they need from glucose, so the person may feel hungry. Blurred vision. High blood sugar can affect the lens and blood vessels in the eyes, causing blurry vision. Tingling or numbness in your hands or feet. So if you have tingling or numbness in your hands or feet, the nerve damage from high blood sugar can cause these sensations. The nerve damage from high blood sugar can cause these sensations. Slow healing sores or cuts. So if you have a sore or if you have a cut and it's taking a long time to heal, that could be a sign of diabetes. Diabetes can impair the body's ability to heal. Frequent infections. So if you have frequent infections, high blood sugar can weaken the immune system, making it harder to fight off infections. So if you have high blood sugar, you could have an issue of fighting infections. So these really are the symptoms of someone who has or who's developing diabetes. Why is it important for early detection? So early diagnosis and management of diabetes are crucial to prevent serious complications like heart disease, stroke, kidney disease, and vision loss. So if any of the symptoms that I mentioned above are noticed, you need to consult your doctor for testing or guidance. So if you have those symptoms, right, you guys need to really pay attention to this. So if you have those symptoms, you need to consult with your doctor so you can prevent complications like heart disease, stroke, kidney disease, and vision loss. So all these 4 things can happen if you have diabetes, if you have those symptoms, but you do not consult with your doctor. Let's go to our third point for today, which is prostate health. Prostate health. So we know that men deal with prostate. So many men do not like to go to the doctor to check their prostate. They don't like how the exam is done. Some of them they don't feel comfortable with the exam. But I should say that as you're getting older, you should get a prostate exam, because this is what's going to prevent you from developing prostate, right? So the exam will benefit you in the long run. So what is prostate health? So you need to maintain good prostate health, because it is crucial for you, for men, especially as they get older. This involves a combination of regular checkups, healthy diet, and an active lifestyle. So regular checkup, healthy diet, and an active lifestyle will kind of help you with maintaining good prostate health. So when you understand the potential issues like BPH, what is BPH? BPH is benign prostatic hyperplasia. BPH is benign prostatic hyperplasia, or prostate cancer. And prostate cancer is important. So you need to understand the potential issues. So if you do not have, if you do not take good care of your prostate, you will develop prostate cancer, or BPH, which is benign prostatic hyperplasia. So what are key aspects of prostate health? Regular screenings. Discuss with your doctor about recommended screening schedules, especially if you have a family history of prostate cancer. Healthy diet. Focus on a diet rich in fruits, vegetables, and healthy proteins, while limiting red meat and unhealthy fats. Cruciferous vegetables, berries, tomatoes, specially cooked, and fish like salmon are particularly beneficial. So, cruciferous vegetables, berries, tomatoes, specially cooked, and fish like salmon are particularly beneficial to prevent you from getting to develop prostate cancer, or BPH. Regular exercise. Physical activity can help reduce the risk of BPH, lower the risk of prostate cancer, and improve overall well-being. Aim for at least 150 minutes of moderate or 75 minutes of vigorous activity per week. 150 minutes of moderate or 75 minutes of vigorous activity per week. Again, join me on Getting Fit Like a Soccer Player every week, Monday, Wednesday, and Friday between 5:30 and 6:30. So that way you can work on your exercise, your regular exercise routine. You need to maintain a healthy weight. What is a healthy weight? Obesity can increase the risk of prostate problems. Quit smoking. Tobacco products are linked to an increased risk of prostate cancer. Stay hydrated. Drinking enough water is important for overall health, including prostate health. Limit your alcohol and caffeine intake. These can exacerbate urinary symptoms associated with BPH, manage stress, because the stress can worsen symptoms of BPH and prostatitis. Stress can worsen symptoms of BPH and prostatitis. So that's why it's important for you to manage your stress. Consider a Mediterranean diet. Consider a Mediterranean diet. So this diet is rich in fruits, vegetables, whole grains, and healthy fats, right? So when you have fruits, you have vegetables, you have whole grains, you have healthy fats, that will be associated with overall prostate health. Understanding prostate problems. So how do you understand prostate problems? An enlarged prostate, common with age, can cause urinary problems like frequent urination, urgency, and difficulty starting or stopping urination. So if you have an enlarged prostate, which is common as you get older, it will cause urinary problems like frequent urination, urgency, and difficulty starting or stopping urination. What about prostate cancer? Prostate cancer is a serious condition where cancer cells form in the prostate gland. While many prostate cancers grow slowly, some are aggressive and require treatment. What is prostatitis? Prostatitis is an inflammation of the prostate gland, often causing pain and urinary problem. Prostatitis is an inflammation of the prostate gland, often causing pain and urinary problems. So what are some of the symptoms of prostate problems? What are some of the symptoms of prostate problems? First, frequent urination, especially at night. Urgency and difficulty starting or stopping urination. Blood in the urine or semen. Pain or burning during urination. Painful ejaculation. Pain or stiffness in the lower back, your hips, your pelvic area, or your rectum. All of these are symptoms of prostate. This could be prostate cancer, or this could be BPH, which is a benign prostatic hyperplasia. So again, what are some symptoms of prostate problems? Frequent urination, especially at night. Urgency and difficulty starting or stopping urination. Blood in the urine or semen. Pain or burning during urination. Painful ejaculation. Pain or stiffness in the lower back, your hips, your pelvic area, or your rectum. So all of these are signs that you may have a prostate problem. So again, today, because this is about men, so if you're a friend of a man, if you know a man, if you are a man, so you need to follow these words that I've just shared with you, because we need to take better care of ourselves. So too many men refuse to go to the doctor because they're scared of what maybe the doctor is going to say, or they are uncomfortable with the type of exam the doctor is going to perform. But again, as I mentioned earlier, so it's better for you to be uncomfortable with the exam, but for you to be healthy in the long run. So I went over heart disease, the risk factors, the symptoms, and how do you prevent heart disease. I went over diabetes. I went over the symptoms, the risk factors as well, and why is it important for you for early detection, for you to to detect diabetes early. You don't want to have heart disease, you don't want to have a stroke, you don't want to have a kidney disease, and you don't want to have vision loss. That's why it's important for you to have early detection. And lastly, I covered prostate health. We went over BPH, which is a benign prostatic hyperplasia, and then we went over prostate cancer. So I went over what are the symptoms for prostate problems. Again, frequent urination at night, urgency and difficulty starting or stopping urination, blood in the urine or semen, painful ejaculation, pain or stiffness in the lower back, your hips, your pelvic area, or your rectum. This was Dr. Moreau in coordination with my wife, Dr. Michelle Moreau, who put this presentation together for me to present to you so you can benefit, so you can take care of your health, because this is really awareness month for men. So I don't want you guys to just focus on this month, but next month, July, August, throughout the year, you need to take better care of yourselves so we can live longer, happily and healthy. This was Dr. Moreau for Cause L'école. I wish you guys a great Sunday. I wish you great health. I wish you a lot of blessing. And don't forget to say thank you to our God for all that He's done for us. Once again, take care and be blessed.